Hello, my name is Johanna Salgado, and I will be presenting on von Willebrand's disease, also known as VWD. A typical patient presentation: a 27-year-old woman presents to her physician that she has been living with frequent and hard to stop nosebleeds. Her nosebleeds start without injury, spontaneous, usually 5 times or more in a year, and usually last more than 10 minutes, and she constantly needs to pack to stop the bleeding. She also notes that she gets easily bruised when she gets hurt. She also worries that she has heavy menstrual bleedings every month. The etiology of the disease is a genetic blood disorder in which the blood does not clot properly. The blood contains proteins that help the body to stop bleeding. One of these proteins are called von Willebrand factor, also known as VWF, and people with von Willebrand's disease lack this protein, or either the von Willebrand's factor does not work properly. Some background on the disease is that 1% of the US population is affected, meaning 1 person out of 100. And von Willebrand's disease affects men and women equally. The condition was first described by Erich Adolf von Willebrand in 1926. The disease can also be inherited through autosomal dominant or autosomal recessive, depending on the type of disease. Before I move on to the different types of von Willebrand's disease, it is important to understand the pathophysiology. Von Willebrand's factor is a large multimeric glycoprotein required for normal platelet adhesion. It also functions as the carrier protein for factor VIII. Platelets have a receptor known as glycoprotein. Von Willebrand's factor binds to the platelets since von Willebrand factor is a multimeric glycoprotein, and it allows the platelets to stick together. Von Willebrand's factor attaches to the platelets by its specific receptor on the glycoprotein that is on the platelet surface, and then connects the platelets in order to cover the damaged site of the vascular injury. Von Willebrand factor protects factor VIII from degradation and delivers it to the site of injury. On the picture on the left, the top picture shows a normal clot formation, the platelets being the blue and the red blood cells. As you can see, the platelets are able to stick together because of the normal von Willebrand factor binding. But on the bottom, as you can see, a person with von Willebrand's disease, the clot formation does not happen as it should. Now that pathophysiology has been described, we can talk about the different types of von Willebrand's disease. Type 1. This is the most common and mildest form of von Willebrand's disease. A person with type 1 has their von Willebrand factor lower than normal. 85% of people with von Willebrand's disease have type 1. They are usually accompanied with low levels of factor VIII as well. And this makes sense because, as we said before, that the von Willebrand factor is a carrier protein for factor VIII. As you can see, the correlation of if there is low of one, there would also be a low level of the other one as well. Type 2, this is a type of von Willebrand disease where the body makes normal amounts of von Willebrand factor, but the factor does not work properly. Type 2 is then broken down into 4 subtypes: 2A, 2B, 2M, and 2N. The subtypes depend on the specific problem of the person's von Willebrand factor. Each subtype has a different treatment. I would also like to mention that blood types can also affect the presentation of the disease, but also the pathophysiology of the disease. Moving on to type 3, which is the most severe and rarest form of von Willebrand disease. This is where the person has very little or none at all of the von Willebrand factor protein. Only 3% have type 3. Now, this is a chart of the different classifications of von Willebrand disease. As we saw, type 1 is reduced levels of the von Willebrand factor protein, and type 2 is characterized as a dysfunctional von Willebrand factor protein. And then type 2A involves the loss of platelet binding and reduced high molecular weight of the multimers. Then type 2B is when there is an enhanced platelet binding of the von Willebrand factor and a high molecular weight of the multimers. And then type 2M involves reduced binding of the von Willebrand factor, but it has a normal distribution of the von Willebrand factor multimers. Then type 2N involves reduced binding of the von Willebrand factor to factor VIII. And then type 3 is characterized by absent levels of von Willebrand factor and as well as low levels of factor VIII. Risk factors of the disease. The main risk factor is having a family history of the disease or any other bleeding disorders. As you can see on the picture on the left, you can see two parents and their baby. The representation of white means that they do hold the gene for the von Willebrand disease. And on the left is a representation of autosomal dominant, where, as you can see, the father has the gene and moved it on to his child. This type is when only one parent has the gene. The different types of autosomal dominant is type 1, 2B, or 2A and 2M. On the right, it's the representation of autosomal recessive. As you can see, both parents have the gene and passed it on to their child. And the types that you could get from autosomal recessive is 2N and type 3. And autosomal recessive is also known as the most severe case. There has also been cases of 2A and 2M with this type of gene. You can also acquire von Willebrand disease, but this is only associated with various conditions, due to sheer stress or a disease causing a depletion of the von Willebrand factor. An example of that would be a aortic stenosis, or if you have a mechanical heart valve, or if you have a Wilms tumor. Moving on into the symptoms, you could have epistaxis, easy bruising, heavy menstrual bleeding. Due to this symptom, women are more likely to be diagnosed quicker than men. Also, you could diagnose a woman with these various symptoms, but also if there is postpartum bleeding for a woman after she gives birth. Like the next symptom is excessive bleeding with injuries or surgeries. So that could be an example for women. There is also blood in the urine or the stool. And you could also have fatigue. And this is due to the microcytic anemia, which is, for example, for women, when they have their menstrual and they're losing a lot of blood, it affects the body, making it weak and fatigued. There is also mucocutaneous bleeding, bleeding of the gums, even such as just brushing your teeth really harsh can cause bleeding of the gums for people with the disease. Diagnosis of the disease. So usually the patient should have a family history of the bleeding disorder or of other blood disorders. And in order to diagnose this disease, there's a series of blood tests that can be performed. The first one that I have listed here is von Willebrand factor antigen, which is a level of measurement of the von Willebrand factor protein. And then there is a von Willebrand factor activity, which just examines the von Willebrand factor binding to the platelets. And then factor 8 just checks the clotting activity. And von Willebrand factor just checks for the amount of multimers of the factor. If there is a decreased level of activity and antigen, it is type 1. If the activity is less than 0.6 of the antigen level, then it is a functional problem of the factor, and it could either be type A or 2B, depending on the specific problem of the protein. If factor 8 is less than the von Willebrand factor antigen, then it is type 2N. And if there is no von Willebrand factor at all, it is type 3. Treatments of the disease. If there is a low factor 8 protein, then you can have a factor 8 transfusion. Oral contraceptives are given specifically for women. This can be useful for controlling heavy bleeding during menstrual periods. There is also a clot stabilizing medications such as aminocaproic acid and tranexamic acid, which can help to stop the bleeding by slowly breaking down the blood clots. And then there is desmopressin, which induces the release of von Willebrand factor and factor 8 from the endothelial cells. This medication is usually given to type 1 or type 2A of von Willebrand's disease. And then these are the references I used to create this slideshow. I hope you gain some more knowledge of the disease with this presentation.